Good evening, everyone. Hope I am audible. Video is clear. Good evening, everyone. Okay, so we will start. Neural tube defect. It's an important topic. So lot of questions are there in previous year, All India and AIMS. So many questions are there. It's a short important topic. We quickly go through this. Now, first of all, something about Unacademy. Yeah, it's India's largest learning platform. So we should be thankful to Unacademy to given us this opportunity to interact. Okay, now see, something about all of you know that Unacademy is now merges with Prep Ladder. So now Prep Ladder and Unacademy, you can subscribe in a single subscription, that is iconic subscription. So what advantage you will have it there? So Unacademy, it's known for its live classes. So you can have all the live classes and live test and quizzes. And Prep Ladder, yeah, you know, known for its video recorded lecture. So you all benefit of both in a single subscription known as iconic subscription. Now you need to take subscription for at least 12 months. At least 12 months. Yeah, if you are targeting long, take this. This is the most advantageous things. Okay, because live classes, recorded classes, so you have advantage of both. So see, Unacademy with Prep Ladder, iconic subscription. Iconic subscription. Just when you are subscribing, don't forget to use my code Dr. Sanjay Khatri. Now see, if you go for this 1 month, Unacademy alone, it's 4,500. Now my suggestion, if you are planning NEET PG 2021 or any exam nearby and you have read something from somewhere, some other platform, just join Unacademy for 1 month and see, all are wonderful educators. They are master in their field. The live classes, you feel it, you taste a feel of teaching. Now what they are teaching to you. So it's very good. Take Unacademy. If you not yet, take Unacademy for 1 month and watch all the classes live. Okay, so this is about Unacademy. Now come to neural tube defects. Now see, failure of fusion of foot process of neural tube between 3rd and 4th week of intrauterine life. 3rd and 4th week of intrauterine life. It's a tube. It will fuse. It will fuse. If there is a failure of fusion, means this tube will fuse definitely. If not fuse, there is a failure of fusion, it will lead to neural tube defect. There is a failure of fusion of foot process of neural tube between 3rd and 4th week of intrauterine life leads to neural tube defect. What it causes? If this tube is formed, this is the tube, so everything will be there in the spinal cord, in the tube. If it's not fused, there is a defect is there. So what happened? So there are the substance such as alpha fetoprotein and acetylcholinesterase which spill into amniotic fluid. Both of them act as a biochemical marker for detection of neural tube defect. Both of them act as a biochemical marker for detection of neural tube defect. If defect is there, so alpha fetoprotein and acetylcholinesterase will come into the amniotic fluid. Both of them act as a marker for detection of neural tube defect. Now see, one thing is, neural tube during its formation on 23rd day fuse from the rostral end and in 27th day fused caudally. Now you can concentrate this 27th day of intrauterine life. 27th day of intrauterine life. So practically 3rd and 4th week of intrauterine life mean till mother know that she is pregnant, neural tube defect already take place. Till mother knows that she is pregnant, neural tube defect is already take place. Now, see what are the causes of neural tube defect. So, number one, drug taken by a mother during pregnancy, such as sodium valproate. Deficiency of folic acid, zinc. Now, new studies are there. Some say there is a deficiency of vitamin A is also associated, but still now proven is folic acid and zinc. Now, infant of diabetic mother, yeah, infant of diabetic mother is a prone factor for a neural tube defect in baby, and radiation exposure mainly in the first trimester. These all leads to neural tube defect. Now, types of neural tube defect. Types of neural tube defect. So how can we see? This is spinal cord. Now see, this is meninges over spinal cord, and now you can see this is the bone. Okay, now see what happened. There are so many neural tube defect, but if defect, sorry, just a minute, whether I can see whether we can rub few things so it's possible, then otherwise we will leave this. Now see, this is meninges and this is bone. Now see, if defect involve only the bone, if defect is there, if defect involve only the bone, this is known as spina bifida occulta. Spina bifida occulta. Now see, if meninges protrude through this defect, if defect is there from where meninges comes out, then it is meningocele. Then it is meningocele. Now see, if meninges as well as myelo both protrude through this defect, this is meningomyelocele. This is meningomyelocele. See, if defect involve only the bone, spina bifida occulta. If meninges protrude through this defect, meningocele. If meninges as well as myelo both protrude through this defect, it is meningomyelocele. It is meningomyelocele. Now see, meningomyelocele, you can also see here, see, defect involve only the bone. Okay, and here you can see meninges protrude through this defect, brown, and here you see yellow, meninges as well as myelo, spinal cord both protrude through this defect. It is meningomyelocele. It is meningomyelocele. So when defect involve only the bone, spina bifida occulta. If meninges protrude, meningocele. If meninges and myelo both, meningomyelocele. Now see, spina bifida occulta. No sign symptoms. Diagnosed accidentally. 15-year-old boy, you did an X-ray for pain abdomen and you find L5 vertebra, there is a gap. So diagnosed accidentally or suspected whenever there is a lipoma, tuft of hair or discoloration patch over back. Suspected whenever there is a lipoma, tuft of hair or discoloration patch present over back. 4-month-old child, you receive a call. Child is taken for cleft palate surgery and they want clearance. But when you examine back, there is a tuft of hair. Go for X-ray or MRI. If tuft of hair is there, you can't rule out. Maybe vertebral defect is there. So that child need a MRI. Can be suspected when there is a lipoma, tuft of hair or discoloration patch present over back. Meningomyelocele The commonest position is lumbosacral. Commonest position is lumbosacral. Now see, if meningomyelocele present at lumbar region, so what are the feature? If meningomyelocele present at sacral region, so what are the feature? This is important to understand, and these all are MCQs. If meningomyelocele present at lumbar region, you find bowel, bladder, incontinence. Bowel, bladder, incontinence. Perianal anesthesia. You may find bowel, bladder, incontinence and perianal anesthesia as meningomyelocele at lumbar region. Then you find flaccid paralysis of lower limb. Flaccid paralysis of lower limb. Flaccid paralysis of lower limb and postural abnormality of lower limb. Child may have club foot, flat foot, eye arch foot. So when multiple abnormality of the lower limb. But see, flaccid paralysis of lower limb. See, flaccid paralysis of lower limb. Flaccid, lower motor neuron signs are there. Now see, if meningomyelocele present at lumbar sacral region, what are the feature? Bowel, bladder, incontinence is there. Bowel, bladder, incontinence is there. Perianal anesthesia is there. Perianal anesthesia is there. Now see, no motor weakness. This is important. No motor weakness is there. No paralysis is there. Only child will have bowel, bladder, incontinent, perianal anesthesia, no sensation of touch and pain, but no motor weakness is there if meningomyelocele present at sacral region. Association of hydrocephalus. Associated with meningomyelocele. It can associated at any position, but literature say if meningomyelocele present at sacral region, chance of hydrocephalus is less. If it present in lumbar and thoracic region, chance of hydrocephalus is more. Chance of hydrocephalus is least if meningomyelocele present at sacral region. So these all are the MCQs. We will cover some MCQs in the end. So you will find how application based question come on neural tube defect. Now see, anencephaly, yeah, it's one of the also neural tube defect. There are so many type of neural tube defect, at least 30, but the common thing 3, 4, 5 we need to remember. Spina bifida occulta, meningocele, meningomyelocele, one of them is anencephaly. What is anencephaly? Anencephaly when whole of the skull vault is absent. Skull vault is absent. Brain hypoplastic. Pituitary rudimentary. So a baby born with absent skull. Skull is not there. You find brain is also rudimentary, hypoplastic, pituitary is hypoplastic. It may associated with multiple cardiac anomaly also. So most of the baby with anencephaly dies after birth within few hours to days. So general guideline, do not resuscitate. What you will do to revive that baby who is not, brain is rudimentary, pituitary is not there, skull is hypoplastic, so skull is not there, skull bone is not there, so do not resuscitate. Now anencephaly incidence is low, but when we are doing MD, every week 2-3 baby born with anencephaly. Why incidence decrease? Because at the periphery also USG available, so they can diagnose anencephaly very accurately, so they can advise termination of the pregnancy. See the pain of the mother who carried that baby for 9 months, if she come to know, we can abort the pregnancy early also. So anencephaly. And one more thing, anencephaly associated with post maturity. Anencephaly associated with post maturity. So got my point. Spina bifida occulta, meningocele, meningomyelocele, Anencephaly. Anencephaly, this is an MCQ associated with post maturity. So can we diagnose neural tube defect antenatally? Yes, we can easily diagnose neural tube defect antenatally, generally between 14 to 18 week of pregnancy, when we do the anomaly scan or blood investigation. By USG you can easily pick whether any sac is protruding from the spine or whether skull is normal or not. Antenatal diagnosis is possible by USG and by biochemical marker. How biochemical marker? Alpha fetoprotein and acetylcholinesterase. Alpha fetoprotein and acetylcholinesterase levels are elevated when you do between 14 to 18 weeks. So by the time you come to know, because these levels are elevated, USG is also suggestive. So go for termination and sit with the family whether they want baby or not. So yeah, antenatal diagnosis is possible. Just remember acetylcholinesterase. This is an MCQ. Acetylcholinesterase, alpha fetoprotein, acetylcholinesterase. Now see, prevention. So why I directly come on prevention? Why not treatment? Yeah, treatment at various aspects. It's revolves so many specialty comes together. Okay, because child have gallbladder incontinence, perineal anesthesia, surgery to be done as early as possible to prevent the chance of meningitis. Later life, child may develop hydrocephalus, neurological complications. So sometimes parents don't want, they are not, initially they are in the feeling of guilt. They don't want to go for the surgery because prognosis is not great if paralysis is there, if in the nerve roots involved. So treatment depend upon so many stage. Okay, but yeah, prevention, it can be prevented by folic acid. Up to reduction is 60% incidence of neural tube defect. So comes in the definition, failure of fusion of foot process of neural tube between 3rd and 4th week of intrauterine life. So time when mothers know that she is pregnant, neural tube defect already take place. So how folic acid will work? Now see, what we suggest the parents there whose first baby is having neural tube defect, we start the couple, mother should start taking folic acid. Mother should start taking folic acid 1 month prior to conception. When they are planning pregnancy, mother should start taking folic acid 1 month prior to conception and continue it for 3 months of pregnancy. Why I am telling 1 month prior to conception? Because once mother know that neural tube defect is there, she is pregnant. So suppose she start taking after pregnancy, so it will not work. Once she know that she is pregnant, neural tube defect is already take place. So folic acid need to start before conception. So 1 month prior to conception, folic acid in the dose of 4 milligram. Okay, so it should be started 1 month prior to conception and continue it for 3 months of pregnancy. Now see, this is the MCQ. This is the MCQ asking once in All India and once in AIMS. See, read this question carefully. Meningomyelocele at lumbar region associated with all of the following except. Simple question, but if you know the concept, you will answer. Loss of gallbladder control, yes. Postural abnormality of lower limb, yes. Loss of pain and touch sensation, yes. Perianal anesthesia. What is anesthesia means? Loss of pain and touch sensation. There is not spastic paralysis. There is flaccid paralysis of lower limb. There is flaccid paralysis of lower limb. So this is not correct. Spastic paralysis not occur. What occur? There is flaccid paralysis of lower limb. Flaccid paralysis of lower limb. Now see, effective way to prevent meningomyelocele is to administer folic acid. Need to begin from when you start folic acid? Definitely before conception. Before conception. So this should be clear. So this question asked 2 times. Folic acid 4 milligram need to be start 1 month prior to conception. The feature of meningomyelocele when it present at lumbar and sacral region, and acetylcholinesterase, a marker for neural tube defect. These questions comes repeatedly in the various competitive exam. So you should know about neural tube defect. It's simple topic but lot of questions. So you should know all these questions. So if you want to hear more from me, so this extra edge series I am continuing now. 9th and 10th, 2 sessions already taken. So third session is today, just after half an hour at 9 to 10, in which I discuss some typical, some tough, some application based question which we are not reading regularly, routinely. So that's why extra edge. If you want extra edge in your preparation, attend these sessions. Yeah, these all are free sessions. Anybody can watch. Go to the Unacademy app and watch this session by Pediatrics by Dr. Sanjay Khatri on YouTube series. Yeah, neural tube defect today we have taken. So I am coming with some more important topics. What are those? Vesico-ureteric reflex, grading, their treatment, all these things. Just in 10-15 minutes we will cover, and you will find 2-3 MCQs in different exam. Neonatal cholestasis, most common cause, most common investigation, neonatal hepatitis, biliary atresia, conjugate bilirubin, unconjugate bilirubin, everything I will be clear for you. Von Willebrand disease, type of von Willebrand disease, clinical features that we will discuss, and approach to metabolic disorder. These 5 topics I have choose for this month YouTube session. If you want any more, you can let me know in my Telegram group. So this is Sanjay Khatri, pediatric educator at Unacademy. So keep reading, let's crack it. Thank you. God bless you all. Thank you.